Good morning, we are from Group A5 and here is a member list of our group. Today, we are going to present a healthy diet for pregnant women. First, we are going to introduce some pregnant women dietary tips. Next, we will discuss about our desired dinner recipe for them as well as the reason for choosing the meals. Pregnant women are required to intake much more nutrition than other adults. In fact, getting nutrition like carbohydrates, proteins, and fats is just a minimum requirement for them since they often experience nausea, lack of appetite, and tiredness. Meanwhile, there are many pregnant women who are deficient in lots of nutrition, especially iron deficiency, and it causes anemia. Therefore, we are going to suggest some dishes which cover a wide range of additional and basic nutrition in the following slides. Let's begin. The first dish is tomato tofu and fish soup. The fish soup tastes both fresh and sweet and rich in nutritional value. Various ingredients need to be prepared before boiling. You can refer to the PowerPoint slides. The suggested intake amount is a standard bowl per time. As there is a small amount of dioxide in the fish soup, we don't recommend the pregnant woman drink too much per time. For the cooking method, you can refer it to the PowerPoint slides and it just takes 6 steps. For the nutrition value of this soup, tofu is rich in calcium. According to the recent research conducted by the Customer Council, half-bread tofu have about 230 to 400 milligrams calcium. Sufficient absorption of calcium during pregnancy can reduce the risk of gestational hypertension and premature delivery. Second, tofu is a conventional food. It is rich in vitamin C. It helps to manage gestational diabetes during pregnancy. Third, tofu with fish is the golden partner for absorbing protein. U.S. Department of Agriculture says that each fish soup have around 2.3 grams protein content per 100 grams. It can help the breast and uterine tissue to grow pregnancy. Fourth, the fish soup contains omega-3 fatty acid. It can prevent perinatal depression by determining the length of gestation. To conclude, tomato tofu and fish soup can match the diet therapy required by pregnant.
The second dish is oatmeal with berries and raisins. The following are the main ingredients. The recipe is simple. We first add a half rice bowl of water and a bowl of oatmeal in a saucepan. Then cook it until it gets less watery in a low heat. When it's ready, pour the oatmeal in a bowl and put the raisins and berries on top. This dish is full of supplementary nutrients like folates, magnesium, iron, vitamins B1 and B5. Also, folic acid is helpful in preventing developing defects as well as assist the growth of nervous system of the baby. In terms of acquiring enough amount of iron, half of the cup of raisins will do the job. Alternatively, this dish is different from other food. It is easy to make and swallow. Pregnant women lose lots of nutrients through vomiting. This dish quickly provides most of the nutrients to mother. The third dish is beef pilaf. The main ingredients include diced beef, basmati rice, cherry tomatoes, and various seasonings. Our suggested intake amount is a standard bowl per time. And the following is the cooking method of beef pilaf. First, we need to add olive oil, roasted cherry tomatoes, and several seasonings in a casserole dish and cook for 4 to 5 minutes. At the same time, preheated the oven at 180 degrees and put the rice and reduced chicken stock into the oven together after it is preheated. Then, put the rice and beef in the casserole dish and cook until the liquid is absorbed. Lastly, add the onions, currants, and parsley to finish the dish. So what is so special about this dish? Beef is rich in zinc and selenium, which is important for both growth. Then, basmati rice is the main ingredient of this dish. It provides most of the carbohydrates that our body need. It also has extra iron and fiber that's also good for a pregnant woman.
Now we have our fourth dish, lemony lentil salad with salmon. Here is the list of ingredients. We suggest that pregnant women should take in a standard bowl per time, about 12 ounces. We designed to make the recipe more healthy, such as lowering the GI, reducing the consumption of salt. Use as little condiments as possible. We don't add excessive dressing or sauces. Moreover, we use extra virgin olive oil to be the healthiest diet. To cook, we whisk those condiments in a bowl. Then we add oil, cucumber, onion, lentils, salmon, and bell pepper. Last, toast them well and done. This dish is plenty of nutrients from maternity. Salmon is rich in omega-3 fatty acids and DHA. Both nutritional values are very beneficial for baby development. Lemon juice is fresh scent can help pregnant women to soothe nausea, which is a symptom of maternity. Red onions, they are rich in amino acids and vitamin C to help fight against diseases. It will be a delicious and nutritious dish. Let's move on to the fifth dish, choy sum with beef. Here is the list of ingredients. This is a popular and normal Chinese dish. It is well known as in its bland taste, but healthy. To cook, we wash the cabbage, slice the beef into pieces, and put the prepared ingredients into a pot orderly. Keep stir-frying for 5 minutes, then it's done. There is some tip to keep healthy. Use vegetable oil to decrease fat absorption and use as little as we can for stir-frying. Although the amount of nutrients is less than the former, it is also beneficial for maternity. 100 grams of beef contains 7 milligrams of calcium, and it is a source of protein. It is reminded that beef and cabbage contain cholesterol. We should not absorb more than 300 milligrams of cholesterol per day, so we control the amount at 200 grams of beef in the dish, and 100 grams of cabbage only contains 0.1 to 0.3 grams of cholesterol, so pregnant women can intake more, as its benefits are way larger than detriments.
So I would like to introduce to you our sixth dish, which is the assorted fresh fruit. So for the list of the ingredients, first of all, we would like to have 1/4 piece of apricot, a piece of banana, 1/4 piece of pomegranates, and 50 grams of grapes. When it comes to nutrition value, apricot contains high level of vitamin A, C, and E, calcium, iron, potassium, beta-carotene, phosphorus, and silicon. This helps with baby's development and growth. Iron helps to prevent iron deficiency, and calcium helps bones and teeth to grow stronger. Potassium benefits heart health for both the pregnant woman and the baby. It also stimulates cells regeneration. Banana are rich in vitamin C, potassium, vitamin B6, and fiber. Fiber prevents pregnant women suffering from constipation, and vitamin B6 helps to relieve nausea and vomiting in early pregnancy. Pomegranate contains plenty of vitamin K, calcium, folate, iron, protein, and fiber. Vitamin K helps to maintain healthy bones. So grapes are also a really awesome fruit for pregnant women. Grapes contains vitamin C and K, folate, antioxidants, fiber, organic acids, and pectin. All the nutrients helps to aid the biological changes that occurred during pregnancy. So thanks. This is the end of the design of all dishes for the pregnant women. These dishes are definitely suitable for them as those are highly nutritious. These dishes brings multiple benefits for the pregnant woman and baby. Most people may think that healthy dishes are plain in taste, but what we designed have considered about this point. Our dishes are both delicious and healthy, and they all have a decent smell and taste. So we think that many pregnant women will like them. Thank you.